afternoon, viewers. Aster CMI is live today with our expert, Dr. Mahesh Chikkachannappa, Senior Consultant, General Laparoscopic and Bariatric Surgeon, and myself, Dr. Vanitha, DMD Resident General Surgery, Aster CMI Hospital. And today we are here to talk about how safe are the laparoscopic and abdominal surgeries during this COVID pandemic. Hi, sir.
Hello. Good afternoon. Good afternoon, everyone.
Sir, could you brief our viewers about various types of abdominal surgeries and laparoscopic surgeries and how safe are those surgeries during this COVID-19 pandemic?
It's a very good question and the hot topic happening these days with general public as well as with the medical fraternity. Good afternoon, everyone. I'm Dr. Mahesh from Aster CMI. As Dr. Vanitha asked, how safe the surgeries are during this pandemic. So it is a pandemic where it's probably all of us are experiencing for the first time, and we as medical professionals are at the forefront handling this problem since last 6 to 7 months. So being a surgeon, we would like to talk about surgeries and how safe they are during this pandemic. So coming to the safety methods and the question about safety, the hospital and the medical fraternity have taken all the steps to ensure a safe surgery as well as a safe recovery for all our patients during this pandemic. And there is nothing specific about any particular surgery which can be done or not during this time. When this pandemic started, there were a lot of speculations about what kind of surgery will be done. But since last few months, our fraternity or our colleagues have evolved various safety measures to conduct all types of surgeries, be it ENT surgery, laparoscopic surgery, or abdominal surgeries, say neurosurgery, orthopedic surgery. When this pandemic started, there were a bit of speculations and reserves about doing particular types of surgeries. But yes, now as time passes by, we are doing most of the surgeries. If you ask me, all types of surgeries with adequate and appropriate safety measures, and we are coming out successful, and patients are going home as usual as we were doing before January or before this pandemic started. So to conclude this, we can do all the surgeries with safety measures from the hospital, fraternity, doctors, and you, the viewers, the patients. We need your help also to ensure that all your relatives get the surgeries done safely and go home safely and continue the same safety norms in the community, at your house and outside, so that you continue being healthy.
Thank you, sir. Sir, I have some questions from our viewers.
Yeah.
I'll just ask them, sir. First question is, what is meant by laparoscopic surgeries and what kind of surgeries we can do in laparoscopic?
Laparoscopic surgery means, in a layman's term, it's a keyhole surgery, wherein we put tiny holes or tiny cuts on the abdomen or any surgeries which we do by keyhole. It is a minimally invasive surgery, and compared to the conventional open method or a big cutting method, it is more minimally invasive as well as less painful, and patients recover faster with this procedure. So most of the abdominal surgeries can be done by laparoscopic or keyhole method. Since last few years, time has evolved and technology has evolved, wherein we are doing a lot of thyroid surgery, that is neck surgeries, then breast surgeries, as well as prostate surgeries by laparoscopic method, and it is very, very safe, and patients get back to work faster, and productivity improves and increases faster. So most of the surgeries these days, even for example, the ENT, head and neck surgeries, can be done minimally invasive with various technologies which have evolved, and it is the way forward. And nowadays, this robotics also have come, which helps us to access areas which was difficult in the laparoscopic era.
Sir, one of our viewer is asking, what is the recovery time post-surgery? And how fast can a patient go back home after surgery? And what are the do's and don'ts need to be followed?
Yeah. This question appears to be general question, though our topic today is about the safety during this pandemic, but still I would like to answer this question. The recovery time following any surgeries, for example, abdominal surgery specifically, if you do a keyhole surgery, probably the patient recover 30 to 40% time earlier than the conventional operation. Okay, and to get back to work, as I said earlier, if it is a conventional surgery, suppose we do a hernia repair by open method, the patient may go back to their work by 8 to 10 days time. Whereas when we do it by keyhole or laparoscopic surgery, 3 4 days earlier they may go back to work or at least be doing their regular activities by 2 to 3 days. That is the advantage by keyhole operation. So, and also it depends from patient to patient. Never a hard and fast rule. Patient to patient it depends, and they have to be motivated to get back to work. They have to be active, and they have to listen to the doctor and be in touch with them. And this will definitely help them to get faster, to get back to their work or to their daily activities faster.
So another question is, what is the infection rate during COVID?
Yeah. This coronavirus 19 or COVID-19 is a virus, and we have many viruses in the past which were much deadlier or problematic than this. So viruses per se does not cause wound infections. So we don't have any literature so far for the last 6 to 7 months which specifically says that there is any infection by this virus, especially the operated wounds. So I would say I don't see there is a change in rate of infection with the coronavirus for that matter. Yes, there can be other problems, but I don't see that there is any wound infection or anybody worry about wound infections. So if they take care of themselves in the hospital and the community during and after the procedure, I'm sure the recovery period will be as good as pre-COVID.
Sir, one more question is it safe to do laparoscopic and abdominal surgeries during this pandemic? If yes, what are the safety measures that you have taken at your hospital?
Yeah, that's a very good question apt for this week today. Laparoscopic and abdominal surgeries are much safer and as safer as the pre-COVID era today, and it is previously compared to before January and now it is safer, and in fact I can say it is much safer than those days because they become much more safer with respect to patients' personal hygiene, hospital, doctors. So all precautions are taken. So I would definitely say that patients should take the advantage of the message from the hospital and doctors to come forward to go ahead with their regular surgeries because it is very safe and we can vouch on that. And what are the precautions you asked means our hospital is well equipped with all the armamentarium to fight against this COVID-19. Right from January, we are following all safety norms. Patients are checked, the temperature is checked when they enter to the hospital, and specific questionnaires are asked which are given to us by our infectious specialist, and they are screened there thoroughly, and then only they are allowed inside. Otherwise, they go to a specific place where they are seen separately. And when they come inside, they are advised to wear the mask throughout their time in the hospital and to maintain social distance. And all the hospital staff are equipped with wearing masks, hand hygiene. Periodically, they are educated about being as safe as possible, and definitely need not to say doctors, anesthetists are taking all precautions which will ensure safe return for the home for the patients after the surgery.
Sir, one more question. Was there any period where you not operated since last 6 months?
Yeah. Once this pandemic started, say February in Bangalore, I think was affected from end of February, March. We were pretty much operating our routine surgeries and we were quite busy until March end. But as the lockdown started, I would say we became a little more busier because many hospitals in the community started, closing doors for elective surgeries for the patients and emergencies for that matter. One is due to lack of knowledge or due to lack of safety measures, and patients also felt that they would be better off in a hospital where all the precautionary measures are taken. So if you ask me, we have never stopped operating due to any reason for that matter. And in fact, beginning of March, April, May, we had more of emergency surgeries. And since April, May end, I think we have started operating on elective surgeries where patients became much aware of the problem and they got educated through various social medias. I'm sure though there are some myths and false messages, but yes, people wisely decided about coming to the hospital, and we have started doing our elective work since last 2 months. So the question which you asked, that we have never stopped operating. Yes, probably it took a little more time and more precautionary measures to make sure nobody is affected by this problem. So yes, we continued operating and we got busier this last couple of months. So things are moving smoothly, and we are sure that much more better as time passes by, and the turnover of the patients to the hospital will get better because we are learning to live in this new normal, and everybody have become much more courageous and brave to live with this and with all precautions.
Sir, what changes do you have implemented in your daily practice, sir, because of this pandemic?
Yeah, as I said, the hospital is taking care of much of the precautions when we are here. And yes, when we come from home, yes, we carry less things to the hospital. And yes, every day we are also checked about our temperature and freshness. Then when we are in the hospital, we maintain social distance. We are a group of surgeons working together, but we have changed the way of practice for last few months so that we visit the patients in a smaller group, and other group takes care of the patients in the outpatient and emergencies. And also, we have educated our junior staff as well as the nurses to take utmost precautions when they see the patients and for themselves. And also, during surgery, all of us are wearing specified like gears to operate. And most of our patients, if it is elective surgery, before surgery they are checked with the COVID. They are checked by the COVID test. Anytime when there is emergency, we have certain protocols to follow, and we are doing some rapid tests and making sure the safety of the hospital personnel as well as the safety of the patient and their relatives is taken care of. So these are the precautions, and post surgery also they are taken care with good pain relief and again the safety norms. And they are visited as they were visited before January, and we have not cut short any method of treatment just because of this pandemic. We are continuing our personalized as well as precautionary care to the patients to ensure that they go home safely. So these are the precautions and methods we are following. Nothing much has changed. We have become much more safer, but the treatment, the procedures, the methods have remained the same. And as I see that since we've taken much more precautions, there are no problems, and patients are going home safely, and they're very happy, and we have got good feedback from many of our patients who are very happy with their treatment in the hospital during the last few months. And we hope we serve the patients in the same manner as the time passes.
Sir, have you operated on any positive patients, or COVID positive patients, and how it was?
Yeah, there have been many, like a few patients which we operated, and initially, yes, we have sat in the group, made discussions, planned the surgery thoroughly so that there are no waste of time in between with the anesthetists as well as the operation theatre personnel. So go in and meticulously and quickly do the procedure safely and come out and change all the gears and make sure like there's no any contamination or anything. And we have continued doing that. And in the hospital, there is separate area for such operations which are not mixed with the daily other routine surgeries. So the hospital has ensured to make sure that there is no mix up because we have to take care of these patients whereas they go. So in that way, the hospital has taken care of all the precautionary measures, and wherever needed, a positive patient is request surgery. We have done it with good care and with the help of the pulmonologists, intensive care doctors, anesthesia doctors. It's been successful, and patients have gone home and have come back, follow up. They're doing very well, and this is what the way forward we have.
So for some patients, we advise laparoscopic surgery, and for some patients, we advise open surgery. Because of this COVID pandemic, any changes are there, sir?
Yeah, as I told earlier, when this pandemic started, there was speculation about problems with laparoscopy, with the aerosol problems, and compared to the abdominal surgeries. We have learned and we have moved forward, taking precautionary measures for these things. So it has come back to how we were deciding before January, before February, for that matter. So as of today, it is as good as how I advised them, pre-COVID era. So there is no changes because all we have, passed on the hurdles, and we have come here with a position where we can take care of them, or we can do procedures which are recommended as per the books.
So one more last question, sir. Do you advise patients to come for elective surgeries now? And if yes, what are the reasons?
Yeah. So as I was telling, when this pandemic started, there were very less elective surgeries. When you mean elective surgeries, means planned surgeries like hernia, gallbladder pains, then lumps in the body, like such cases. But since, as I told you, since last 2 months, because of the media and because of the education by the, like hospital personnel and healthcare personnel, patients have become much more courageous, and we have also evolved to give a, proper standard of care to the patients. And I would recommend, like to all the people who are listening or viewing this program, not to worry about, being coming to the hospital, because this is the new normal we have to deal with, and it's just that you have to take precautions and move forward. So if you have a problem, you can always come and meet us. It is much safer than ever, and we can offer the specified or the recommended care to these patients. So I welcome all the patients who are having problems or worried sitting at home to come to the hospital, because we don't want them to come in an emergency situation where things are very fragile, and it definitely affects the outcome from the surgery, and it will increase the morbidity, means suffering with the problem, because some problems which are there for a long time, say like gallstones, they had infection, and if they are at home fearing to come to the hospital, they may have to come eventually to the emergency with severe pain and infection, and this can actually hamper the smooth sail towards, procedure and going home, and staying in the hospital can increase and the sufferings and leading to problems can happen. So similarly, cancer problems, cancer surgeries, if they wait too long, it can spread to different organs and it can become an advanced procedure. So it is recommended that at least they first come to the hospital, meet the doctor, and take advice. And based on what the doctor advises, they can go ahead with the surgeries. And I can assure you, it is much safer, very safe, and safer than ever in the hospital to provide the specified care to a particular patient.
Sir, here is a question from our viewer by you, Deepa. His question is there any treatment available for gallstones without surgery?
Yeah. Okay, so having gallstones is a very common problem, which as a surgeon I would see on a day-to-day basis. So all patients who have gallstones may not require surgery. Patients who had some episode of pain on the right upper side of the abdomen with a proven gallstone by ultrasound scan should seek help from the doctors and advice, so that we are not not dealing with the patient who is having infection due to stones or a stone slipping down causing other problems which can be sometimes dreadful. So coming to the question you asked, Deepa, uh, basically, there is no specific medical treatment for gallstones. Stones are produced due to a diseased gallbladder, which is started becoming less functional, and there is stagnation of bile in the gallbladder, leading to sedimentation of the chemicals in the bile, leading to stone formation. So sometimes small stones can slip and go into the intestine, and it may not be there in the subsequent scan, but you are bound to produce much more stones. And that doesn't mean that you require surgery all the time. So as long as you know when to see a doctor, means in pain or discomfort in the right side of the upper abdomen, then it is okay to wait. And if somebody is diabetic and somebody is having onward of pains in that region, I would recommend them to see a surgeon and get their advice accordingly.
So what is the take-home message you want to give for our viewers?
Yeah, so the main idea of this program is to encourage the public and create an awareness about the COVID pandemic from a surgeon's perspective. So basically, we want to tell the viewers or the public that it is safer to go to the hospital and you can meet the surgeon to get the advice and get the prescribed treatment appropriately. If the surgery, the medical management, yes, you meet your surgeon and get advice from them. Don't have a diagnosis with you and stay at home and suffer with the problem and come to the hospital when there is an acute nature of this, wherein we may be not able to help you 100%, and even if we help, sometimes it can be, like problematic, wherein your stay in the hospital and your expenditure in the hospital can increase because you've been waiting at home with the problem and you come to emergency, and when you come to emergency, and especially people who are older, then they may need ICU, intensive stay, then the operation procedure may take longer time, and if you come and there is a severe infection, whatever would have been done by chemo can, land up in, having a, surgery that is a, operation by having a weak cut, wherein they have to stay in the hospital for a longer time, and getting back to work, productivity all increases by 30 to 40%, and also they may have to spend more, and also it affects the relatives or bystanders, leading to various socio-economic issues. So my recommendation or suggestion to people out there viewing or listening to this program is to, if you have a problem, it's better to seek help from the doctor at least once. Come to the hospital, meet your doctors, and don't treat yourself. That is another big problem, wherein you start having pain medicines or medicines prescribed by like friends and family. And at the same time, I want to emphasize that we have video consultation at Aster. So get the help from that. If you're fearful or you want to first talk to the doctors, we are available for video consultation. You can buzz the hospital, get an appointment to speak to the doctor over the phone, and also have a one-to-one video consultation and get a basic idea. And you also can get a basic idea about what is the problem you have, and we can specifically suggest you that to come to the hospital, and so that we can examine and take a call on that. Or if it can be managed over the phone with the patient who can understand the treatment, we can always tell them by video consultation, at least to begin with. So they are in the loop and they can understand, when to see a doctor to a particular problem. So I would recommend, if somebody is, like fearful, to come to they can, talk to me over the video consultation and get the help from that. At the same time, I would recommend, patients who are there, especially, who have some vague lumps, tumors in the body, which they already know, to come and seek help from our department and make sure they're not missing things or make sure they're not too late. So my recommendation to all of you there is to, you can to give consultation and speak to us over the phone and see us, talk to us over the phone, or feel safe to come to the hospital, drop by, and preferably come alone or with one attendant, so that you don't feel worried about it, and we'll take care of you.
That's a good message, sir. Thank you so much, sir. So that's a wrap. Thank you, viewers, for joining with us for the session. Hope it is useful for most of our viewers, and hope we have answered most of their questions. If there is still any questions left, you can just drop it in the comment section. We will answer it shortly. Thank you.